we have a very diverse specialty clinic. We have neurologists that come out. We have diabetic specialists. We have orthopedists. We have a general surgeon that takes care of a lot of things in this community that previously may have had to go elsewhere. So I'm proud of the services that we provide this community.
We run the full gamut as far as the types of patients that we take care of. And I think having that rural clinic designation, I think that allows us to really kind of, again, exemplify to the community that we're doing everything we can to be sure that we're always providing the very best of care and the very safest of care and the highest quality of care to them each and every day. You truly do get to take care of loved ones, friends, and be there in their times of joy as well as in their times of sadness. And though that can be real hard, especially when things aren't going well, I've always thought, who better to be there than for that family member or that patient than someone who actually lives in their community and truly does have a bond with them in some way. And I think that's probably the best thing that we do, is we're there for people when they need them, and we're there not only just as a nurse, as a physician, as a lab tech, but we're there as their friend, as their community member.
The Yuma community is mostly farmers and ranchers, or some aspect of farming and ranching. The majority of the businesses in this community revolve around farming and ranching. That's what our community was built on, and that's really what sustains our community. But just good, hardworking people that want to raise their family out here.
It's just a different type of person. I've done lots of rotations in Denver, and they're great people, don't get me wrong, but farmers are different, and when they're coming in, it's a different type of sick, because they don't come out of the field unless they're about ready to need an ER or keel over. So if it's planting season or if it's harvest season, you better set up and take notice, because they're really sick, they won't come in, and it's just a different type of person.
In order for the scenario to play out where young couples can start businesses here, or we can attract businesses here, whether they be agricultural based or otherwise, you have to have a workforce. You have to be able to retain and attract people to work. And obviously, healthcare is a huge part of that retention and that recruitment. So the hospital and the clinic here really adds not only to sustain what is here, but to help us grow Yuma in areas that make sense for Yuma to grow. And quite honestly, that doesn't happen without access to healthcare.
For me, the biggest thing is making sure that this facility is the best that it can be for this community. I don't want to see these communities dry up. I don't plan on ever leaving here if I don't have to. I love it here. I want to raise my family here. And I want them to have the availability of the services that we have. So I think the biggest thing for me is just making sure that it is viable for this community, and this community is viable in the long run. So, like I said, I don't know what this community would look like if we didn't have Yuma District Hospital here.
Out here we don't have the volumes, so we have a lot less, reimbursement. We have to spread those costs out between fewer people. So people are having to pay more. If our reimbursements are cut, then it's affecting, those folks with having to help catch up where the others were cut.
I know a lot of the hospitals, especially smaller ones, are getting worried about where our funding is going to come from and stuff, and we've got to survive because our community has to have us. I mean, it's just such a vital part, not only as an employer and of a lot of people in Yuma, but just my family. My family all lives here.
We need a good hospital in Yuma, Colorado. because of the ag industry. It's an industry that has, risks of injury, risks of contamination, through chemical or fertilizer issues, just doing the job, and dealing with livestock can also be dangerous. And we've just got to have a hospital that can serve those needs.
We have used the local hospital facilities and medical facilities, and we are glad to see those facilities out in this area, as we're 150 miles away from bigger operations in the cities.
A facility like ours in a small community is too important just to let the market decide. I honestly don't know what this community would look like without a hospital here, or any other small community out here that has a hospital. It would be devastating to our community, really, to not have the facility that we have.
Farming and ranching and the returns on the crop that you get are very variable on the prices. So we're not on a set income per se. So even though you put a budget out there, it is hard to meet those budgets sometimes. And then as everything else increases, not necessarily does our revenue as producers increase. So then it can be tough to pay premiums and things like that.
So Medicaid expansion has really changed medicine across the board, and certainly in Akron. In Akron, when I got here 3 years ago, that was probably the biggest change that had happened, that was starting to bring in people who had not had health care for years. I literally, the first probably 6 months to a year, I saw so many people who had not seen a doctor for 10, 20 years for all kinds of chronic issues, and they finally got care.
When I talk to, young families, maybe they have a couple of kids that are school age, and their premiums for their health insurance, if they're a self-employed farmer or rancher, and their premiums for their insurance are double what their house payment is, or something like that. I mean, they're really having to look at what they can afford, and they're probably not getting the best insurance that they can have out there.
Right now, I know there are people that have had to drop their insurance because they cannot afford it. They need to put clothes on their kids' backs and survive with it, buying some food, things like that. And I do have even some neighbors that I know of that really had to drop their health insurance. It's a terrible deal. And if they would have a family health issue come up that's life-threatening or whatever, it would wipe away their whole life savings. It really would.
They're wanting us to manage costs better from the ground all the way up, and so the only way to really manage those costs is, again, looking at population health and trying to, I keep saying that, but be proactive in our health management versus reactive.
The people who were going to the emergency room because that was the only place they could go, that's stopped because now they have Medicaid, so they're coming to the clinic, they're getting regular care. I think if they strip away some of that Medicaid, they're going to go back to going to the emergency room. I mean, I think that I've seen the people who were frequent flyers in the emergency room now don't go at all. They come into the clinic, they come for regular visits, they do their preventative stuff, and they are staying healthier, I think.
I think if you look at where our healthcare is right now as far as cost containment and being able to control the really out of control and spiraling out of control costs of our healthcare, when you look at where that's coming from, it's really coming from our chronic conditions. Our chronic conditions are diabetes, heart disease, hypertension. We now have so many people with diabetes. They're now saying it's 1 out of 4 adolescents are pre-diabetic. That's an epidemic, and if you don't start to treat that with primary care where you correct things early on, that is what's leading to us having bariatric surgeries, $100,000 surgery, CABG, which is a heart surgery because of having a heart attack, $100,000 surgery. We can't afford to have half of our country have $100,000 surgery in their lifetime even, and with 1 of 2 people in the United States now having heart disease and that being their reason that they die, that is what we need to control, but long before we get to the heart attack, and that's primary care.